Anwar Mazai, who's a graduate student at UC San Diego, and Saad Gulzar, who's a graduate student at NYU. I'd also like to thank, before I start, the collaborators who made this possible. There was kind of a fairly heavy lift for this project on the implementation side, so I want to make sure that they're acknowledged and given credit for their effort. So this motivates much along the lines of what Rima was just speaking about. So we're going to kind of present results from two closely linked experiments that are both aimed at targeting health worker absence. This paper, I guess, is part of an agenda to try to understand kind of, one, why is it so widespread? So this is something that's common in, Latin America, East Africa, South Asia, and elsewhere. And second, why is it kind of so persistent and intractable? So what is it that makes this kind of such a tough thing to affect? And specifically, why is it that monitoring initiatives, which are mostly sort of focused on working along the margin of the probability of detection, why is it that kind of those tend to be hard things to kind of really get a lot of action out of? So in this specific case, we're going to kind of take as a point of departure that the extrinsic incentives in this environment are, fairly dysfunctional, or at least in some sense are dysfunctional. In our case, we have absence rates of about 65%. And we're going to see, can we kind of learn anything about the intrinsic motivations to work in these jobs, and see, first, we want to ask a question kind of in steady state, under status quo incentives, is it true that kind of personality measures are predictive of whether or not doctors are attending work and whether or not health inspectors are completing inspections? And kind of more importantly, is it more predictive than other data that's sort of easily available, other demographic measures that we can easily obtain? Second, we want to ask, are these personality measures related to how people respond to these change in incentives? So if I introduce a monitoring initiative that's going to increase the probability that someone who's missed work is going to be detected, can I figure out who's going to respond to this initiative? And one kind of additional insight that emerges from this is that these are sort of substitutable incentives, right? So it may be that if I'm monitoring in a world where everybody is highly motivated, some change to this type of incentive is kind of irrelevant. Whereas if I'm kind of in an intermediate zone where people are sort of on the fence and the marginal type is kind of very responsive to these type of incentives, it may be that in these cases you could imagine that the intervention is going to have a bigger effect in terms of the increase in attendance. And I'll talk about this in some more depth in a moment. And the final question we're going to ask in this paper is, if I'm give information, and so the type of information you need to act on absence to a senior health administrator, am I going to be able to identify who's going to use that information to take action and change the state of affairs? Can I identify who that person is based on their personality? So to kind of drill into this a little bit deeper, I mean, this really is a prediction exercise. We're not going to be able to say anything about whether these matter causally. But on this final point, we kind of designed the intervention in such a way that the only thing we could imagine would mediate information is kind of an individual's decisions and how an individual takes data and makes decisions based on data. So we think it is relevant. So why focus on intrinsic motivations in the first place? Well, kind of at a very broad level, governments are governments made of people. We know a lot about kind of decision heuristics and biases that people have when they make decisions. So we could imagine that these are also relevant in the public sector. Thinking specifically about these personality measures, we know that in other domains, so predicting wages, predicting whether or not individuals have a job, these do tend to be highly predictive, sometimes more so than things we think would really matter, like IQ. And so, we want to kind of bring this to bear in the public sector and say, is this equally predictive or kind of more predictive than other measures? So again, broadly, kind of what are potential benefits that we could get from thinking along these lines, or why should we engage this agenda in the first place? First, we think it could begin to provide some basis for diagnostics and hiring, some insights into sort of bureaucratic insights. Second, we know from research, and I think it's also pretty sensible, that sort of the profile of applicants, or the people we could imagine drawing into the public sector, is going to be a function of adjustable features of that job. things like the wage, things like where the post is located, and so on. So if we know that we can affect the profile of applicants, understanding how that profile is going to kind of predict performance is important. Finally, there's a big literature in labor economics and in personality psychology that suggests these traits are malleable. They're malleable over the life cycle and can be influenced by interventions, so they at least kind of provide a potential avenue for policy. So what are we going to do in this project? We're going to try to answer these 3 questions. We're going to do it using 2 experiments. The first is to implement a smartphone intervention that we designed that kind of works using the existing health monitoring network. The second is going to be to sort of take the data that we're collecting from rural clinics that's being presented to executive district officers, so sort of senior health officials, and make kind of absence in that data salient to test whether or not that has effects. And then we're going to measure performance. So this, we're going to observe 3 performance metrics. First, we'll observe whether or not the doctors are in the clinic kind of through an independent inspection. Second, we'll collect data on the rate of health inspections as well. Finally, we'll be able, because we're going to have kind of an administrative record of whether or not doctors are present in the clinic and an independently collected record of whether or not doctors are in the clinic. We'll have some basis also for looking at whether or not inspectors are colluding with doctors to kind of game this system and try to predict that with personality as well, and that's actually highly predicted by personality. I think probably the most important feature in this paper is we're able to get these personality measures from 3 sets of officials. So first, we have a large representative sample of doctors working in basic health units across Punjab. We also have the universe of health inspectors, so all of the health inspectors working here. And finally, we also have the universe of senior health inspectors as well. So these are people who are, there are 36 districts in Punjab. Punjab's a province of about 100 million people. So these are people with a fair amount of administrative authority. So it's interesting to try to kind of gain insights into their decision making. Just to give a quick preview of the findings, we find that these personality traits positively predict doctor performance, and they negatively predict whether or not doctors are going to include with the inspectors. The traits also strongly predict responses to the monitoring intervention, and finally, they're going to predict whether or not senior officials, when given information about absence in hospitals, react by going and kind of subsequently reducing the rate of absence in that same clinic. Okay. So first, I'm going to describe kind of the intervention, how we set it up and designed it. I'm going to provide an overview of the research design, how we get at these questions. I'll give you a little bit more insight into kind of the model behind this, why we think we should get heterogeneous impacts of a monitoring intervention, kind of depending where we are in the distribution of worker types. And then I'll summarize results and talk a little bit about our conclusions and where we might go next. Okay. So to understand the monitoring system that we set up, it's important to understand the background institutions. We really embedded this kind of directly in the existing monitoring network. So to provide a highly simplified org chart of how the Department of Health works, there's a health secretary who's in charge of the whole thing for the province. Beneath him, so there are 36 executive district officers. So to kind of keep it general, we'll call them senior health officials. Beneath them, there are health inspectors. These health inspectors, they're mandated with kind of inspecting each of the facilities in their jurisdiction. They have about 30 facilities, inspecting them once a month. And then inside of the clinics that they're in, the facilities that they're inspecting, there's a doctor and several other health staff. So this is the sample. This is the set of clinics we were working in Punjab. This is about 30% of the basic health units that are in Punjab. We drew the sample to kind of try to be spatially representative. And so just for those of you who haven't seen a basic health unit, this is what it looks like. It's responsible for kind of very basic frontline service delivery, basic outpatient services, and so on. Okay. So the way the monitoring system worked kind of prior to our intervention and the way that it's going to be working in the control districts, so kind of our point of comparison, is that when the inspector went to each of the 30 facilities that he had been assigned, he would carry with him a paper form. And the idea that he would collect on the paper form information about kind of availability of medicine, cleanliness of facilities, and worker attendance, and then this information would be kind of slowly aggregated up through some process and provided in reports to EDOs, be used as a basis for kind of allocative decision making and for thinking about health policy. All that we do is something very simple. We take the exact survey form and implement it using a smartphone Open Data Kit interface. This kind of affords us two real advantages. One advantage is that the aggregation process is instantaneous, so it gets aggregated on a dashboard, which I'll show you in a minute. And then it also provides an incentive to the inspector. So whenever he completes an inspection, it's going to be geo-stamped and time-stamped, and he's going to be required to take a picture of every one of the staff members who he reports as being present. So here's Yasser piloting the original product in Hanawal. This is the dashboard. So we wanted to create kind of a very simple set of views that would communicate the information quickly. This would be kind of what the secretary might see. So this is going to report the number of inspections as a share of the number of inspections assigned, kind of moving along the x-axis district by district. And our hope here was just so that you could get in a quick view, here are the districts where inspections are happening regularly, and here kind of are the districts where inspections aren't happening. If you scroll down, you can get to a phase in the dashboard where you have kind of real-time streaming instances of the reports. So every time an inspector completes a report, it would instantiate and it would populate up here the intervention, which I'll emphasize a little bit more later, that we were trying to kind of see whether or not this information was being used and how it was being used. We just kind of created an arbitrary rule about which of these reports, so each row corresponds to a report, which of the reports we would kind of flag for action. We made that rule kind of a very simple one. If 3 of the 7 health members who were assigned to be working there weren't present, it was flagged as kind of being an underperforming facility. So this is kind of an example of a picture from the dashboard. The dashboard also has a geographical view, so it's all about kind of summarizing and providing information. This is an overview of our experimental kind of design. So we piloted the kind of the back end and the smartphone product in Hanawal District first, just to make sure that the technology was working and we could implement it sort of at scale. And then we implemented it in 18 districts, so half of the districts in Lahore. Are in Punjab. Okay. We also, in this process, collected data from the inspectors, the doctors, and the executive district officers. We first will collect personality measures. So we used a personality measurement instrument that was from psychologists at Quaid-e-Azam University. It's sort of been adapted from the standard 5-factor model used in the United States to be appropriate to Pakistan. We'll measure the kind of the characteristic 5 dimensions: openness, conscientiousness, extroversion, agreeableness, and emotional stability. Personality psychologists think of these 5 dimensions as kind of broadly being able to describe most of your personality. And so these would be kind of some of the example questions that would allow us to measure these personality traits. We also kind of use a standard measure of public sector motivation. So this is going to have 6 dimensions as well. And we kind of, started with a fair amount of skepticism about this, because this is exactly the type of questions you could imagine is very, very easy to game. I don't know what this means, like what the latent trait is that corresponds to public sector motivation, but this winds up being highly predictive, despite being kind of fairly transparent and obvious questions. Okay. So let me just kind of put this a little bit in a framework to think about what we should predict, and if we were to kind of introduce a unit change in the detection probability using some new monitoring intervention, what sort of response should we predict kind of based on types? So if we kind of imagine a distribution of individuals in terms of their, let's say, motivation or aptitude for public sector work, and we were to line them up kind of from one end of the room to the other, with maybe Adnan over there on the left, and kind of think about how should we expect individuals to respond. I mean, it depends on what that distribution looks like, but if you believe that kind of most types are in the intermediate range in terms of kind of their degree of motivation, then I think a very kind of fairly basic idea would be, if everybody's really, really motivated, a change to incentives isn't going to matter all that much. People are working for other reasons. Also, if everyone's extremely demotivated, it may be very, very hard to mobilize them, but if you're at some intermediate range, then perhaps it could have effects. Okay, so let me now turn to results. First, these are just predicting in steady state, so just in the controls, kind of do doctors show up based on these personality measures? There's some predictive action here, especially on the public sector management or public sector motivation index. Each of these lines corresponds to a separate regression with a standardized regression coefficient. The left-hand side is the left-hand side variable. So whenever you see a dot off the zero, you can think of that as being kind of a positive correlation. Ask the inspector to carry a phone. The phone's going to be geo-stamped and time-stamped, and then he's going to take a picture of everyone that he's reporting present. Well, a simple thing that he might do would be to call ahead and say, show up for the picture. And so, there'd be a simple way to kind of get the person on the record of having attended, but they weren't really there kind of for the rest of the day. And in parallel, so we're going to make 3 separate visits to these facilities over the course of the year. There's 850 of these facilities. So a simple thing we could do would be to say, if you were never there in our independent inspections, and that's not hard to do when 65% of doctors are absent, if you were never there, but were always there in every administrative report, then potentially you were colluding on this measure. And I think this kind of is substantiated because it winds up being kind of down the line very highly predicted by these personality characteristics. So I have the kind of the personality of the inspector, who's one side of the party to this collusion, and then also I have the personality of the doctor. Here I just have the doctors, but kind of everything seems to predict whether or not we observe this for a doctor. Okay. That's going back. So just to mention briefly, if we're only interested in prediction, if we aren't interested in whether there's a latent trait here or a trait that really is having a causal effect, we could imagine, let's just use other data. Why do we need to go to the problem of, or kind of all the effort to collect these personality measures? These other things don't seem to do very much relative to this measure. So if we kind of run a horse race, tenure in the post, tenure in government generally, age, education, kind of every simply measured demographic doesn't perform as well as this does. Okay, so let me report results from experiment 1, and then I'll move on to results from experiment 2. So again, this is going to be kind of just an experimental evaluation of the monitoring system. We randomly selected half of the districts to implement it in, and we're just going to look to see, are inspectors under this regime who have a certain personality profile more responsible than others? So this is just the average effects. Kind of the control is the bottom blue line. The treatment is the red line. We started in an environment where health inspections happened about 22% of the time. So they're supposed to happen every single month. The kind of the official objective is to have 100%. In steady state, it's about 22%. After we introduce the monitoring intervention, we got up to about 56%, and then had some attenuation towards the end of the program. If I look at this by the personality of the inspectors, so I have about 110 inspectors who now have this shock to their incentive where they have to carry a smartphone that kind of geotags their inspections. I can kind of look to see, so the blue line across the bottom is the rate of kind of monitoring over a 2-month period in the controls. The red line is among kind of the treatment group. And so kind of roughly in line with the predictions of this framework, we find that the treatment effects really are biggest for these individuals in kind of in the intermediate zone. That's true if I break this down trait by trait. I'm looking at an index of these 5 personality traits. Anyway, that's kind of roughly consistent. Now looking at the second intervention, so this is going to be one where we just manipulate the salience of the data on health worker absence. So again, we're going to have reports of absence kind of streaming from the health inspectors directly to executive district officers who presumably then kind of take this information and make decisions about where they want to go, take some sort of corrective action. We can observe whether or not they actually do anything in 2 ways. The first is we just look to see whether or not attendance improves subsequently. So I kind of look to see whether or not a facility winds up on the dashboard, and then kind of check to see if a couple weeks later the attendance of health workers has improved or not. Second is we collected some data on time use as well, and we don't have a lot of inspectors, or we don't have a lot of executive district officers here, but we also find kind of some movement in how they're spending their time, kind of allocating across the tasks that they've been charged with. So again, this is the intervention here. So all this is we're just going to kind of highlight a facility is underperforming when it shows up in an inspection, and there's nothing more to this. It's kind of a very, very simple intervention. We just highlight it in red. This is a way of kind of visualizing the effects. So again, this is binding when 3 or more of the 7 staff are absent. So kind of everything to the right here. So this is going to be kind of a measure of whether or not this was inspected, and then we're going to have our own independently collected data on health worker attendance on the x-axis, and we see kind of this large and discrete jump moving from 2 to 3, which is where this flash began to bind. And if there's questions about mean reversion or other explanations, kind of moving across every other threshold essentially serves as a placebo exercise or as a falsification exercise. So it does look like this had a pretty, and the effects are, they're actually fairly substantial. So if only two workers were absent, the probability that the doctor himself is absent subsequently is about 60%, and that drops down to about 40%. So kind of the effect is not only significant, but also sort of substantively large. And so if I look to see kind of which personality profile is driving this change, we do find that it is these guys who score well on the Big 5 index, so kind of who have a high Big 5 index. And in fact, kind of moving 1 standard deviation, so these are all normalized measures, moving 1 standard deviation is enough to kind of basically drive all the action, so like 40 percentage points. So it's fairly substantial, enough to make us think that kind of personalities really matter in this decision. We also have, as I said, we're getting to a very, very small sample now because we're only in the universe where we have kind of treatment districts who are getting the data, streaming over the dashboard, and then, so that's only 17 of these guys. But if I look to see at time use, and I look at how many flags they're receiving, they're spending more of their time kind of monitoring and managing these facilities in cases where they're getting lots of flags through the dashboard. So we kind of can say the mechanism is a reallocation of time towards managing these facilities. Okay, so let me quickly summarize. First, just broadly, we designed and implemented a smartphone monitoring system. We think it had some nice features. One was that it kind of used the existing monitoring network, so we were able to get pretty good coverage with not a lot of smartphones. We only kind of had 90 smartphones in the whole project. And we find that the effectiveness of this incentive reform really did depend a lot on traits. So kind of the personality of the people who are being affected by the change to incentives is important. So broader policy implications. First, like in other domains where these measures are predictive, it seems that they also kind of matter in this domain as well, or potentially matter in this domain as well. And kind of second implication is that the same unit change to incentive can have very different impacts depending upon the underlying profile of people in the public sector. And the final point I'll make is that the second intervention I described, this manipulating the salience of the absence data, is really a minor intervention, but it had, at least on the face of it, fairly big impacts. And so this kind of suggests to me, in the set of things we might consider that are policy relevant for reforms, just taking the issue of sort of policymaker psychology and decision making in their mental space to process information they need to take action, this might be a place where we can kind of make some productive gains in terms of learning about how to improve outcomes. So thank you.